The patient lies strapped to a chair, their eye pried open as a long steel instrument is placed against the corner of the socket. With a swift motion, the doctor strikes it with a mallet, driving the metal into the skull. He wiggles it back and forth, severing delicate tissue in the frontal lobes. Minutes later, he withdraws the tool, declares the procedure a success, and moves on to the next patient. This is not a scene from a nightmare, it is the reality of the ice pick lobotomy. Procedure once hailed as revolutionary and honored with the Nobel Prize. The roots of lobotomy stretch back to the 1930s, when Portuguese neurologist António Moniz pioneered the leucotomy. Believing that mental illness stemmed from overactive connections in the brain, he drilled holes into patients' skulls and injected alcohol or cut tissue to sever those pathways. Reports of calmer, more docile patients won him international praise, culminating in the 1949 Nobel Prize in Physiology or Medicine. What began as crude brain surgery soon spread across the world as a supposed miracle cure. In the United States, lobotomy found its most infamous champion in Dr. Walter Freeman. Seeking a faster, simpler method, Freeman developed the transorbital lobotomy, performed not in an operating theater, but often in his office. Using a long, ice pick-like instrument called an orbitoclast, he inserted it through the thin bone above the eye socket and tapped it into the brain. With a few sweeping motions, he severed neural connections thought to fuel anxiety, depression, or psychosis. The procedure required no anesthesia beyond electroshock to render the patient unconscious, and could be completed in minutes. Freeman toured the country in his lobotomobile, performing thousands of operations in mental hospitals, sometimes lining up patients and operating one after another. By the 1940s and 50s, lobotomy was being performed widely on tens of thousands of people. Some were severely ill, but others suffered from conditions we would treat today with medication or therapy: depression, anxiety, or even difficult behavior in children. The promise of a quick fix, combined with desperate families and overburdened institutions, fueled its rapid spread. At first, the results seemed miraculous. Patients who had been violent or suicidal often emerged calmer, quieter, easier to manage. Families saw loved ones freed from torment, and institutions praised the newfound docility. Newspapers celebrated the surgery of the soul, and Freeman became a celebrity doctor. But behind the headlines lay devastation. Many patients emerged not just calmer, but stripped of personality, initiative, and emotion. They became passive, childlike, and in some cases, incapacitated. For every apparent success, countless others were left permanently damaged. Tragedies piled up. Freeman operated on Rosemary Kennedy, sister of future President John F. Kennedy, in hopes of easing her emotional struggles. Instead, the lobotomy left her with severe cognitive impairment, confined to institutional care for the rest of her life. Other patients died from hemorrhage, infection, or brain damage. Yet Freeman continued, convinced of his mission, performing more than 3,500 lobotomies. Before his license was finally revoked after a patient died on his table. The rise and fall of lobotomy mirrors the desperation of psychiatry in the early 20th century. With few effective treatments for severe mental illness, doctors turned to extreme measures. Lobotomy promised control over chaos, but at terrible cost. It revealed both the ambition and the recklessness of medicine, willing to gamble with lives in search of solutions. By the late 1950s, the tide turned. The advent of antipsychotic drugs like chlorpromazine offered safer alternatives. Studies revealed the profound and often catastrophic effects of lobotomy. Public opinion shifted from celebration to horror, and the procedure was increasingly condemned as barbaric. Within a generation, lobotomy went from Nobel-honored innovation to a cautionary tale of medical hubris. Today, the very thought of inserting an ice pick into the brain is shocking. Yet for decades, it was accepted, even applauded. The story of the lobotomy forces us to confront uncomfortable truths about medicine, that even celebrated discoveries can become disasters, and that desperation can blind us to the human cost. The ice pick lobotomy remains one of history's darkest medical chapters. Cure that destroyed the very minds it sought to heal.